Live. Hello, it's Bill, the knee pain guru, and welcome to the Ask Dr. Beck show with
Good morning, everyone.
Dr. Beck. Good morning. How are you doing today?
I could use another day's worth of sleep.
Okay. Me as well. You're heading to a conference in Florida.
Orlando.
How about that?
Yes, indeed.
Yeah, if you would like to see Dr. Beck live and in person, see him in Orlando.
Shingle Creek.
Pardon?
Rose and Shingle Creek.
Rose and Shingle Creek. Okay. Let's see. Here's Ask Dr. Beck. Okay. Let's see. Let's dig into the questions for today. Anything new and exciting? How's the building coming along?
Siding is about close to 2/3 done.
Mm-hmm. You've been seeing patients for this.
Your seeing patients for this would be the third week. Yep.
Third week. Okay. Yep. Awesome. And you have now accurate GPS coordinates. They can get
it's accurate GPS coordinates. It's crazy to look at the hoops you have to go through to confirm that the address is yours. Yes, Google, you can actually update it. Yes, Facebook, you can actually update it. I mean, it's just nuts.
Huh. Wow. So you do it for them.
I mean, yeah, I'm doing the work and they're still saying, we don't believe you.
Oh, geez. What a world we live in.
For real. Sometimes the post office can't even find it, and they're the ones who gave us the address.
Oh, boy. Okay, well, that'll make us crazy talking about the world that we live
in. Yes.
Okay. This question comes in from Sylvie Hurd. How do you release the tension in the hips and lower back? I just had surgery a week ago, and I'm in agony over my lower back. Okay, well, this is the first time I'm seeing this question. I will definitely post the lower back pain video that Perfect. Sylvia can work with. Good. But maybe there's something else you have to contribute in terms of being able to help her perspective. I think. And this is for Sylvie. It probably would have been helpful to include the type of surgery you had a week ago, what was going on to have that surgery. Maybe more information.
And if you had pain before versus after.
Right.
So let me think about how to describe this so it makes sense. Let's start with, I'll give a couple scenarios. No pain prior to surgery. So you have surgery. What happens is they put you under, put you on the table, and once you go under, and I'm not trying to make this sound bad, but your body will be positioned to make it easy on the surgeon. So and they have a number of different tables out there, but it may mean moving body parts. It may mean getting people to hold body parts. And when you're under and you have no muscle control, if they don't bring that body part back into its original position in a way that your body can understand, often it will tense and you will wind up with, we would call it somatic dysfunction, altered motion of the body part afterwards. And the surgeons, I mean, they aren't taught, most of them, anatomy and how to do manipulation like we are in osteopathic school. So they don't feel like it exists or it's not a big enough issue to deal with. And so you wake up and now things that were in place prior to surgery are not in place post-surgery, and you have pain. So, I mean, the simple answer to the question without being able to put hands on is that would be something that you could stop in and see someone for. And that is number one scenario, no pain prior to surgery. Number two scenario is pain prior to surgery. And, here's the thing. If the surgery took care of the pain, you wouldn't be texting about it or emailing about it. So we're going to assume that the pain either stayed the same or the pain got worse after surgery. And again, same thing I said about putting you on the table and moving you around. But because many of these surgeons don't look at the alignment of the joints and how they move with your hands. They look at an X-ray, CT, or MRI, and they go, "Oh, hey, look, the joint looks straight, good enough for me." So what you can have is a surgery which moves that joint or the surrounding joints into more of a dysfunctional pattern, and then there is more pain after the surgery.
Question for you. This doesn't seem to be an applicable.
Yeah, I noticed that.
And I used to be able to block people, like,
Oh,
ban them or block them. And apparently that doesn't seem to be the case anymore. So
okay.
Anyhow, I keep clicking on it thinking I'm going to see something different. Anyhow, that we do not have a question. I do, though. And this is concerning a body being under anesthesia, and the doctors and during the surgery, body parts are being moved around.
Yes.
And you were talking about involuntary or contractions.
Yep.
Does this happen while the person is under anesthesia?
Yeah.
I'm trying to understand.
Yeah. So let me take theoretically you or I being asleep. And so thus what happens is our conscious system, nervous system, is offline, right? We're asleep.
Right.
Subconscious nervous system is there checking in. It's able to move our body. And so should we wind up, I don't know, rolling over on a tennis ball, for example, because some people wear shirts with tennis balls in them to keep them in a certain position, your subconscious says, that's probably going to be painful after a while. I should probably move away from it. And
Right.
so you move into a position that then keeps you out of pain.
Mm-hmm.
So that's if we're not under anesthesia.
Mm-hmm.
Put someone under anesthesia, and that secondary system, the subconscious, is offline. It can't move you. And so then what happens is we can move the body into a place where there is abnormal tension on a joint, or more than one joint, or perhaps the whole body. And if you're out, you can't give the surgeon feedback.
Mm-hmm.
So what happens then is when you start to wake up, your body goes, something's not right here. Better turn on the little red light on the dashboard. It says something's wrong. Mm-hmm. And then again, because the surgeons aren't taught that, we need to do a mechanical alignment, it doesn't get addressed. And so you wind up now fully awake in a body that has mechanical dysfunction, and they don't know what to do for it. They give you pain medication, but pain medication doesn't fix mechanical issues. So if you have a mechanical issue, then it's just not right until you see someone with the skill set that can take care of it.
Mm-hmm. Yeah, that makes complete sense. And once again, this would help Sylvie understand her situation a little bit better. Once again, I'll post that link to the Comella Foundation. We have a video that we've recorded for hips and lower back that you can work with. If you want more information, please include more about the type of surgery that you had, what Dr. Beck was asking about. I think the more information you provide, the more helpful he's able to be. For those that we have some people live online here, if you have questions, please type those in the comments section or the live chat, and Dr. Beck will answer your questions for today. We're going to cut away here just briefly to do a little promo for the Comella Foundation here, our nonprofit 501c3. Here we go. Our mission at the Comella Foundation is to relieve pain naturally using osteopathic healing principles. The Comella Foundation is recognized as a nonprofit 501c3 under the Internal Revenue Code. Your contributions are greatly appreciated. Please consider taking a moment and donating to the Comella Foundation to help us continue our important pain relieving work. Every little bit helps. And we're back. Okay. Anything else to tie a bow on Sylvie's question or situation with lower back pain?
No, I think that's a good answer. Find somebody who has the skills to help you out, and spend a little time with them, and that should resolve your issue.
Perfect. Great. Okay, so if you are watching the replay and would like to submit your questions to Dr. Beck, we do these every Friday at 8:30 a.m. Eastern Time. You can submit your questions on the ComellaFoundation.org website, and there's an Ask Dr. Beck button at the top of the page that you can go to that'll bring you to where you can submit your question. Okay. I think we're going to tie a bow on it today.
Oh, I have one more thing I could add.
Oh,
Spend a couple minutes if you don't mind. Occasionally I'll get people that come into the practice and they'll say, oh, I've been seeing my fill in the blank practitioner for X number of times. And most often that's a couple of years.
Mm-hmm.
And I'm not any better. What should I do? And it always brings a chuckle. And I always try to be as politically correct as possible.
Mm-hmm.
Because this is my thought. The only thing that we do over and over repeatedly is eat and sleep, pee, poop, those bodily functions that are kind of required every day.
Yes.
If I said, hey, Bill, I got this great car for you. The only catch is you got to take it to the mechanic once a week and have the mechanic look it over and do whatever is necessary in order to be able to keep driving it.
Mm-hmm.
What we know is that you'd look at me and you go, yeah, that's not the car for me. I want to take my car into the mechanic every 3,000 or 5,000 miles whenever it needs an oil change and once a year to get the service that it needs.
Mm-hmm.
And that's it. And so why is it different in healthcare? That's the question that I ponder often, and it's how I try to answer my patients.
Mm-hmm.
Is that I tell them, I want you to hold me to the same criteria.
Mm-hmm.
But if we've worked 3 or 4 or 5 times and you have absolutely no change, then either I'm not the right practitioner for you, which is certainly a possibility, or we have an incorrect diagnosis, or both. And so we put our heads together and, hey, I'm willing to do 1 or 2 more treatments, but I'm not going to keep seeing you for months or years if we're not getting anywhere. And that same metric should be held with everyone.
Mm-hmm.
And I'll just pick one story is, hey, I see my massage therapist and I get done with my massage therapist and I don't feel any better. Well, it may not be that massage therapy is incorrect for you. It may just mean that you don't have a good fit with that particular massage therapist. So try something different. And, it's the thing that I think as owners of our bodies, if we think of our bodies and use the analogy of a car, it should only go into service when it needs it.
Mm-hmm.
And I mean, yes, you do preventive maintenance. When you do preventive maintenance, you get in the morning, you start it up, you look at the gas gauge, you look to make sure the oil light's not on and the tire pressure light's not on, and you drive away. Mm-hmm. Which is wake up in the morning, have whatever beverage you have in the morning, and as you sit down, check in. And if everything feels okay, you probably don't need a service. Mm-hmm. Unless you just want to go in and, get it detailed, which is okay. You can go and do things like that. But it just provides a different light on looking at how we can get potentially conned into trusting someone to take care of our health and then not see the results we're expecting.
Mm-hmm. And how much do you bring into the conversation with your patients their responsibility? Because, for instance, way back when we first met, I was competing in judo.
Yep.
So, I mean, I'd go to fill in the blank for your practitioner, but then I'd get thrown and my neck would be out or my back would be out, something like that. So I needed some level of support.
Yep.
For me to be oblivious to those factors and how they were contributing to what was going on in my body.
Absolutely.
There's got to be a patient responsibility or a client responsibility in that equation.
Yep.
Okay.
So that was your question and looking for feedback there?
Yeah, looking for feedback. I think that, and it sets up the conditions. And that's where I think we have a very broken down system where you have people who don't want to take responsibility for what's going on in their bodies, putting the onus on fill in the blank of your practitioner to fix them.
Correct. So the answer is multifaceted.
Mm-hmm.
And I'll start by a story. So one of the first patients I ever treated was a monster truck driver.
Okay.
And kind of famous monster truck. And
Mm-hmm.
I'm like, wow, tell me about that.
Mm-hmm.
And tell me about your life. And so, this person is going through and describing their motorcycle accidents, their car accidents, their monster truck accidents, their sprint car accidents. And I'm thinking, I haven't put my hands on you yet, but I'm assuming that I'm going to put my hands on, and your body to me is going to feel broken.
Mm-hmm.
And oh my goodness, was I ever wrong? I put my hands on it. I'm like, wow, you've been injured? Where?
Yeah.
Because their body was in good shape.
Mm-hmm.
So I think the first part of the answer to the question then is, if you are in good physical condition and you continue to do physical conditioning, your body is then able to be more resilient
Mm-hmm.
to things like getting thrown in judo. If you are less athletic and it's a weekend warrior thing, you're more likely to obtain injuries because your body is, for whatever reason, less able to adapt. Okay.
Mm-hmm.
That's the first part. The second part is physics happens.
Mm-hmm.
And what you're describing is physics. You get thrown. The moment you hit the mat, a vector or vectors come into the body, and that energy has to be handled by the body in some way. And for the most part, if you can't yell loud enough or wince or whatever it is, then it gets stored.
Right.
That is then where a practitioner of some sort, anywhere from massage therapist, all the way up to osteopath, or potentially even hot tub, right?
Mm-hmm.
Anything that's going to release energy can be beneficial. And if the energy is released in the correct way, curative.
Mm-hmm.
So if you know that's going to be happening to you on a weekly, monthly basis, whatever, absolutely. Those support visits with your practitioner to help you maintain your top physical condition, absolutely necessary.
Mm-hmm.
But for example, in Sylvie's case, for example, the woman who gave the question before, the low back pain that she's in, if you get an accurate diagnosis, goodness, a month and a half from now, it should be gone.
Mm-hmm.
Might take a couple of treatments, might be able to get it done in one, but that back pain shouldn't be there for a long time.
Mm-hmm.
Again, if you have the correct diagnosis. And one of the things that I see, and I was talking to a patient about it this week, is that in osteopathy, we learned the osteopathic triune, which is a triangle with mind, body, and spirit at all the apexes. And very commonly what we go in and get worked on is only the body, leaving the emotions and our belief system unsupported and unseen. And what I would say is it's very often that people come in, and if you see whatever's going on with them, if you see them for why they came in and you acknowledge it, the healing begins. And it's very often that people come in to see me with a physical complaint, but the physical complaint is not the issue.
Mm-hmm.
There is something deeper going on that's emotional or a belief system. And if we can address that, then the body instantly starts to change and unwind.
Mm.
So again, it kind of goes back to if you have the right diagnosis, then you can choose the right treatment and you should expect a decent outcome.
Mm-hmm.
So with going back to your judo, if judo is physical for you, absolutely. You see somebody, no big deal. If judo was a way for you to block expressing an emotion or to hide something about your belief system in life, then what's interesting is those visits with your practitioner probably aren't going to get you incredible results.
Mm-hmm.
And it's just looking and looking and looking and making sure you have the right diagnosis. That's what can help.
Mm-hmm. Got it. Okay. If anybody has any questions, please type those in the live chat. Make sure to give the video a thumbs up, like and subscribe to the channel. Turn on notifications for future videos. And once again, we have the link down below. If you have a question for Dr. Beck, you can head on over there to the ComellaFoundation.org. This link will also be in the description box where you can submit your questions.
Thank you, Bill.
Thank you, Charlie. Great to see you.
Good to see you, man.
Okay, we're going to wrap it up. We'll see everybody next week.
Take care, everyone.